The 1970s television show, Mission Impossible, always began with a scene in which the team leader, Mr. Phelps, would receive a tape describing his next mission. The tape always began, "Your mission, should you choose to accept it." Today I challenge you to embark on a mission possible, to find a cure for those suffering from an invisible illness called cystic fibrosis, or CF. Codename 65 Roses. For the next few minutes, I invite you to take great strides and walk alongside me as I tell you about cystic fibrosis, how it has affected me, my family, and many others. Psalm 139:13. For you created my inmost being, you knit me together in my mother's womb. There's a secret code in every gene in your body. Secret codes, or mutations, are present on every gene, on every chromosome, making you uniquely you. For the next few minutes, I invite you to take great strides and walk alongside me as I tell you about cystic fibrosis, how it has affected me, my family, and many others. Unlike most secret agents, I intend to reveal my cause to you and enlist your help to raise awareness and funds for cystic fibrosis research with the goal of finding a cure and adding tomorrows to the lives of many. Let me begin by defining cystic fibrosis. Cystic fibrosis is an autosomal recessive disease characterized by abnormal airway secretions, chronic endobronchial infection, and progressive airway obstruction. If you are like I was a while back, then all those technical words just went right over your head. So basically what I was saying was that these cystic fibrosis kids have lots of snot all over the inside of their lungs. So much snot that they have trouble breathing and require lots of medicines, treatments, and special equipment to keep them alive. Remember our secret code name, 65 Roses? Well, that is actually a tricky way that these sweet, snot-nosed babies learn to identify their illness. You see, when a child says cystic fibrosis, it sounds a lot like 65 roses. So now you are in on our secret code. Breathing issues are not the only problem that cystic fibrosis patients have. They also have trouble absorbing fat. They need to take pancreatic enzymes, dozens of pills every day, in order to absorb their food. CF patients feel like they have a constant hug on their lungs. The mucus is very thick and makes it hard to breathe. Every activity, including eating, exercise, and breathing, must be planned and considered carefully before leaving the house. Every cystic fibrosis patient is a little different in the problems they have breathing and absorbing food. They need to take pancreatic enzymes. There are more than 160 mutations identified that are known to cause cystic fibrosis. It is even thought that some carriers may exhibit symptoms. So as you can see, much more research is needed. Earlier I promised to tell you how CF has impacted my life. When my nephew was born in 2012, he was diagnosed with cystic fibrosis. Since my brother was stationed in Guam with the U.S. Air Force and there was not adequate medical care on the island, baby Ryder, his 2-year-old brother Ranger, and their mom came to live in our home. I began to learn about cystic fibrosis at that time. The Lord had a great plan before Ryder was even born. My grandfather's best friend from childhood was Claude Prestige. They grew up together and are still best friends. Claude is now a pediatrician. He is my doctor, has been the pediatrician for all of my brothers and even my mom. And when God brought Jen and the boys to Texas after an exhaustive around-the-world airplane trip, he provided hope. We were able to take Ryder to Claude's home and lay him in the arms of one of the world's pioneers in cystic fibrosis care. In his career, Dr. Prestige has seen the average life expectancy of cystic fibrosis patients go from toddler to preteen to nearly 40 now. Since Ryder first came to live with us in October 2012, he has increased his treatment and medication regime. He has to take enzymes and applesauce every time he eats anything. He takes about 30 pills a day, plus other medicines for his lungs and vitamins and salt for his pancreatic insufficiency. In February 2013, he's also gotten a chest percussion therapy machine that shakes him for 30 minutes twice a day. In February 2013, my brother Patrick was restationed to Luke Air Force Base, Phoenix, Arizona, and Ryder soon had a little sister, Izzy, who is also affected with CF. Izzy is now almost a year old and has her own little pink vest. My brother Patrick has recently retired from the United States Air Force, and their family again moved in with us in June 2014. For the summer of 2014, our family has been greatly affected by cystic fibrosis. Our routines revolved around the hours of treatments, medications, feedings, and care that are required to keep Ryder and Izzy healthy. This stinks as bad as their diapers. Babies should not be tied to the clock in treatments. They should have time to learn to crawl and explore, talk, and read. I am witness to this every day. J.R.R. Tolkien wrote in The Lord of the Rings, "Still around the corner there may wait a new road or a secret gate." Ryder and Izzy also have a secret gate. Their cystic fibrosis mutation includes a gateway mutation, G551D. This is very important in current research because there are now new medications that are in trials that can block the gateway to cystic fibrosis and promise a healthier life and the hope for a cure in the future. This trial is not yet open to Ryder or Izzy because they are too young. When they become eligible, the cost for this drug is reported to be $300,000 each year. We are not alone. There are hundreds of families in Texas affected by cystic fibrosis and many more around the world. Cystic fibrosis was likely the cause of Frédéric Chopin's suffering and death in the 18th century. I may have a new favorite composer. I am hopeful that you have chosen to accept the mission set before you. You now have a new awareness of a disease which has affected me very personally. There is currently no cure for cystic fibrosis. The life expectancy for people with CF is mid to late 30s, depending on the mutation. What can you do next? Take great strides. Great Strides is the annual Cystic Fibrosis Fundraising and Awareness Walk. Our team is known as the Malone Rangers, and we have raised several $1,000s in the past few years to help fund hope. I challenge you to join me. Donate to the Cystic Fibrosis Foundation, educate your friends and family, and support research financially. Managing this disease can be a challenge and often overwhelming. Join my team, become an agent of change. A license to cure is available to you if you accept my challenge and join the Cystic Fibrosis Foundation in the fight against this clandestine killer. Unlike the TV show, this mission will not self-destruct in 5 seconds. This mission will continue until a cure is found, and every child born with cystic fibrosis can look forward to many more tomorrows. Exodus 23:25. Worship the Lord your God, and his blessing will be on your food and water. I will take away sickness from among you. Now that's a promise.